Hey there, it's therapy and relaxation. Today, we're talking about the impact of trauma on communication styles. Let's go! Trauma leaves an indelible mark not only on the inner landscape of those who experience it, but also on the ways they interact with the world and the people around them. The echoes of traumatic experiences are not always visible. They are often woven into the fabric of how a person communicates, how they speak, listen, and respond in the presence of others. Unpacking the impact of trauma on communication styles is essential for fostering understanding, empathy, and more respectful, authentic relationships. For many, trauma begins as a deeply personal wound, whether from a single overwhelming event or a tapestry of smaller chronic hardships. While each individual's experience is distinct, trauma frequently disrupts the foundation of safety and trust that healthy communication relies upon. When these fundamentals are shaken, patterns of interaction can shift in subtle and profound ways. One of the most common shifts is a tendency toward either withdrawal or aggression, though these represent just the outer ends of a wide spectrum. For some who have experienced trauma, communication becomes fraught with anxiety. An everyday conversation may trigger memories of past distress, leading to a reluctance to engage openly. Words become measured, guarded, or even absent. The person may seem distant or emotionally unavailable. This withdrawal is often a protective response, born from an unconscious fear that vulnerability may once again invite harm. Conversely, trauma can also manifest as a heightened vigilance or defensiveness in communication. Individuals may overreact to perceived criticism, interpret neutral remarks as threats, or become argumentative and combative in their tone. What may appear as hostility or stubbornness is, in many cases, a learned survival mechanism. The individual, having once needed to defend themselves against real danger, may now react similarly in far less threatening circumstances. Communication, therefore, is filtered through a lens of hyper-alertness, with a constant undercurrent of anticipating harm. Avoidance is another pattern frequently seen in those affected by trauma. Difficult topics, confrontations, or even positive emotional exchange can feel overwhelmingly risky. Rather than expressing their own needs or feelings, individuals may acquiesce, stay silent, or physically remove themselves from conversations altogether. They may worry that their words will be misunderstood or rejected, undermining any motivation to advocate for themselves. Over time, avoidance can become entrenched, leading to unspoken resentments and a breakdown in trust within relationships. Trauma also shapes how individuals interpret nonverbal communication, the gestures, facial expressions, and tone of voice that so often convey more than words ever could. Someone living with the aftermath of trauma may misread a partner's sigh or furrowed brow as anger or disappointment. Even when this is not the case, these misinterpretations can breed confusion, defensiveness, and a cycle of misunderstanding that further isolates the individual. At the heart of these communication patterns are the core beliefs and emotions shaped by traumatic experiences. Feelings of worthlessness, guilt, or shame can color every interaction. People may worry that if they reveal their true feelings, they will be judged, rejected, or made vulnerable to further hurt. Their sense of agency and trust in others may be diminished, resulting in a pervasive self-censorship or a compulsion to please rather than to authentically connect. But trauma does not only impact the traumatized individual. Its effects radiate into families, friendships, workplaces, and communities. Loved ones may notice changes in behavior, tone, or engagement, and may in turn feel confused or hurt. Without an understanding of trauma's impact, these communication difficulties can create distance or conflict, even as both parties yearn for connection. Awareness of trauma's imprint on communication provides a powerful pathway to empathy. It reminds us that what we perceive on the surface, withdrawal, irritability, silence, or argumentation, is not necessarily a reflection of intention or character, but often a strategy developed in response to pain. By shifting from a stance of judgment to one of curiosity, friends, family members, and colleagues can create space for safer, more honest dialogue. Recognizing these patterns in oneself is also crucial. Individuals affected by trauma may find themselves wondering why certain topics leave them anxious, or why they struggle to assert their needs. They may notice that they apologize excessively, struggle to accept praise, or dissolve into tears or anger seemingly without reason. Rather than interpreting these reactions as defects or personal failings, understanding them as learned responses opens the door to compassion and healing. Therapeutic approaches to trauma recovery often include work specifically focused on communication. This can involve learning to identify triggers, people, topics, or even phrases that recall the original source of trauma. Gradually, with support, individuals can experiment with new ways of expressing themselves, ask clarifying questions rather than assuming the worst, and use grounding techniques to manage anxiety during difficult conversations. One powerful intervention is the practice of assertive communication. Unlike passive or aggressive patterns, assertive communication encourages individuals to state their needs, boundaries, and feelings honestly and respectfully. For those whose trauma has undermined their confidence or safety, learning to express themselves assertively can feel liberating and empowering. Therapists may coach clients in using I statements, such as I feel or I need, which promote ownership of feelings and reduce the likelihood of the other person feeling blamed or defensive. Equally important is learning how to listen, both to oneself and to others. Trauma often disrupts the ability to accurately gauge one's own feelings and needs, leading to confusion or detachment. Mindfulness and self-reflection exercises can help individuals tune into the subtle cues of their bodies, thoughts, and emotions. In relationships, active listening, giving full attention, withholding judgment, and seeking to understand can foster trust and reduce misunderstandings, creating space for healing. For those supporting a loved one affected by trauma, patience and validation are invaluable. It can be difficult to witness someone struggling to express themselves or misinterpreting benign interactions. However, responding with empathy, reflecting back what you hear, and gently reassuring the person of your intention to understand can go a long way. Recognizing that progress may be slow and nonlinear is important. Safety in communication is rebuilt step by step. It is also important to note that trauma does not define a person's destiny. While it can shape communication patterns, these patterns are not immutable. With insight, commitment, and support, individuals and those around them can develop more effective and authentic ways of connecting. This process involves not only healing from the past, but building new, positive experiences of communication and trust in the present. Furthermore, cultural context interacts with trauma in complex ways. In some cultures, emotional expression or confrontation may be discouraged, leading those affected by trauma to bury their feelings even further. In others, there may be stigma attached to admitting to having experienced trauma at all, making open communication feel impossible. Sensitivity to these nuances is critical for clinicians, family members, and friends alike. Trauma-informed communication is now recognized as a best practice in many fields, including healthcare, education, and social services. Professionals are trained to recognize signs of trauma and adjust their communication styles accordingly by maintaining a calm tone, offering choices, and being transparent about what will happen next. These practices not only minimize the risk of re-traumatization, but also model respectful and compassionate interaction, offering clients a template for safer communication. Ultimately, understanding the impact of trauma on communication reframes the way we see ourselves and those around us. Instead of labeling someone as difficult, cold, or overly sensitive, we are invited to consider the unseen battles they may be fighting. We are reminded that every person has a story, and that the roots of their communication style may stretch into long-buried pain. By cultivating awareness, empathy, and new skills, it becomes possible to turn trauma from a barrier into a bridge, one that connects rather than divides. As trust is rebuilt and voices are reclaimed, relationships can move beyond cycles of misunderstanding and toward deeper acceptance and fulfillment. In this way, the scars of trauma need not dictate the future of our relationships or our capacity to communicate. Instead, they can serve as reminders of our shared vulnerability and our profound capacity to heal through connection. Thanks for sticking around. Don't forget to subscribe us and check out therapyandrelaxation.com for more. See you tomorrow.